Hello there and welcome to the weekly Outside Views report on Welsh politics. Economy Minister Vaughan Gething has unveiled a packed programme of Welsh Government international trade missions for spring 2023, lending his support to Welsh businesses travelling the world in the next few months to develop their exports. The announcement was made as the latest business delegation from Wales travelled to Dubai in the United Arab Emirates for the Middle East's largest medical trade show, the Arab Health, on January 28th in 23. The medtech businesses were joined by businesses from a variety of sectors seeking to explore opportunities in this global trade hub. In March, Welsh businesses will be visiting Dublin to meet with potential new clients and partners as part of a series of activities to promote Wales internationally around St. David's Day. Ireland is the fourth most popular destination for Welsh exports and presents great opportunity for businesses across all sectors. In addition, the Welsh Government's agency supporting the creative industry in Wales, Creative Wales, is leading a mission to support businesses at the Game Developers Conference in 2023 in San Francisco. The delegation at GDC will be joined by other Welsh businesses looking to develop their exports in the San Francisco Bay Area, a part of California with a GDP of over $500 billion. From April, the Welsh Government will lead 7 new trade missions to 5 countries across 3 continents. The markets and exhibitions in the program have been selected to reflect current international developments which present real opportunities for Welsh businesses. Visiting the export market itself can be a crucial element of winning and maintaining business, whether it be visiting an exhibition or networking with potential customers, and Welsh Government is inviting Wales exporters to sign up to attend. The new program continues with a trade mission to Atlanta, Georgia for MRO Americas between the 18th and 20th of April. Airlines, commercial air transport, maintenance, repair and overhaul suppliers, manufacturers, regulators and industry experts will meet for the industry's leading event in North America. Advanced paramedics practitioners, or APPs, across Wales are helping to treat more people in the community and avoid unnecessary hospital admissions. Data from the Welsh Ambulance Service shows that up to 70% fewer people needed to be taken to emergency departments when responded to by an advanced paramedic practitioner compared to traditional crews. Providing a link between primary and secondary care, APPs are paramedics who also care for patients in a primary care setting through a rotational working model and are based in general practitioner surgeries, community care centers, and on the road in rapid response vehicles in the community. They have undertaken rigorous additional education to respond to 999 calls, make advanced clinical decisions, undertake medicine reviews, and in some cases, even prescribe medication. Common calls attended by APPs include chest pains and breathing difficulties. If an advanced assessment determines that there are no clinical need for the patient to be taken to the emergency department, an APP can provide immediate treatments, working with primary care or alternative pathways to undertake medicine reviews, social care, mental health support, and other interventions. Following a review of their role in 2017, work is underway to build on the success of the rotational model. In several health boards, APPs are as navigators within the integrated urgent care centers, where they provide remote consultation to 999 callers, directing them to alternative appropriate services to avoid unnecessary hospital admissions. Increasing the number of APPs is part of the Welsh Government's rehabilitation framework commitment for rehabilitation services to deliver support and care closer to home. By keeping people who have suffered a fall, a frail, or which have an acute or urgent requirement for rehabilitation services out of hospital, the chance of a positive patient outcome is increased. By referring patients to rehabilitation specialists, including physiotherapists, for treatment, problems such as muscle wastage, which can be triggered by hospital admission, can be avoided. First Minister Mark Drakeford has announced the Welsh Government will be funding up to 140 medical student placements each year at the new North Wales Medical School. The new medical school in North Wales will train hundreds of medical students and ensure training opportunities and the provision of qualified doctors are spread across Wales. Training will begin in 2024, with student numbers increasing until reaching capacity from 29. A gradual increase in students will allow time to assess and evaluate the quality of tuition and student experience at the new medical school. The First Minister met students at Bangor University who are benefiting from state-of-the-art technology to study anatomy. The facility was backed by Welsh Government investment, and the students are from the first cohort of Cardiff graduates to have received the majority of their education in North Wales. Rural Affairs Minister Leslie Griffiths has congratulated Ferraris coffees in Bridgend after the company secured a new contract which will see their products available in the United States and in Canada. The minister visited their facilities and heard how Welsh Government support has helped the company secure a significant deal to supply 3 of its products to a major retailer across the Atlantic. The news comes as the Welsh Government recently announced exports by businesses in Wales have recovered beyond pre-pandemic levels. The Welsh Government remains steadfast in its ambition to drive further growth in Welsh exports. Ferraris secured their deal at Sile Paris, one of the world's largest food innovation exhibitions in Paris, in October. Attending as part of the Welsh Government Pavilion, Ferraris Coffee were amongst the Welsh producers, taking the opportunity to meet with buyers and distributors from across the globe, looking to secure new business opportunities. One of the products making its way to the USA and Canada is the Piacenza, which is company's original recipe and has stayed the same for nearly 90 years. The other 2 products are the Siena and Mocha Italia coffee beans. Wales is set to become the first UK nation to introduce a mandatory national licensing scheme for tattoo artists and those working in body piercing, semi-permanent makeup, acupuncture and electrolysis. That's what Chief Medical Officer Frank Atherton has announced. The scheme aims to reduce infections, eliminate poor working practices, and will create a central public register for licensed practitioners and approved business premises. It is the final phase of changes introduced under the Public Health Wales Act 2017 to improve standards of infection prevention and control in the industry. There are an estimated 3,516 practitioners operating in Wales who will need to be licensed, and 1,868 premises that will require approval under the new mandatory licensing scheme. The pass rate for those practitioners who have so far voluntarily already undertaken the Level 2 award in infection prevention is 95%. A 12-week consultation has been launched to seek the views of all stakeholders, including practitioners, local authorities and the public. Climate Change Minister Julie James has published a consultation on ambitious but credible targets for Wales to meet 100% of its electricity needs from renewable sources by 2035. Wales is already making good progress on previous targets set in 2017 and already generates 55% of their electricity from renewables. The minister proposed Wales set a target for at least 1.5 gigawatt of renewable energy capacity to be locally owned by 2035, excluding heat pumps. There's also a target for 5.5 gigawatt of renewable energy capacity to be produced by heat pumps by 2035, but this is subject to scaled-up support from the UK government and reduction in the cost of technology. A service providing mental health and well-being support for teachers and education staff has been awarded over £600,000. That's what the Minister for Education and Welsh Language, Jeremy Miles, has announced. The funding will see the school well-being service run by Education Support extended and will increase the reach and depth of the program. Education Support is the only UK charity with expertise in supporting the mental health and well-being of the education workforce. The School Wellbeing Service provides free advice and support for schools across Wales with a focus on staff well-being. Wellbeing advisors work with schools to provide resources and advice on policies, practices and strategies that support staff mental health and well-being. The £600,000 additional funding announced will increase the amount of well-being advisors who will be able to support schools to transform their school cultures and improve staff well-being. The new advisors have already been recruited with the expanded program due to launch on January 30th. Development of tailored support for teaching assistants has also been commissioned. Health Minister Elnett Morgan has announced £5 million to increase the number of allied health professionals, so-called AHPs, and increase access to community-based care to help people remain active and independent. Available from April, the funding will increase the number of community-based AHPs and support workers in the NHS. They will help people stay independent and well at home, helping to prevent hospital admissions, and they will also help people to be quickly discharged from hospital with the right support and rehabilitation in place to recover at home. Allied health professions is a group of 13 professions which include physiotherapists, speech and language therapists, occupational therapists, dietitians and psychologists. Based in local community health teams, they provide preventative and early intervention services, alternatives to hospital admission, and reduce the need for long-term social care. Supporting people to recover at home with rehabilitation or spend less time in hospital bed can have a considerable benefit on people's well-being, improve health outcomes, and speed up recovery. And this concludes this week's report on Welsh politics. I'll see you in my next video tomorrow. I'll be back.